For many, many cats, vet visits are absolutely terrifying, and in the clinic, I see how it impacts the cats and their people every single day. I'm Dr. M, welcome to VMC. In today's video, I am going to walk you through some simple and effective ways that you can help to support your cat and make vet clinic appointments calmer, easier, and much less stressful for your feline friend. So join me, you'll learn something today. On average, cats receive less veterinary care than dogs do, and a big part of this is because of how challenging people find it to get their cats to the vet clinic for regular veterinary care. And as a result, cats will end up experiencing more suffering because medical issues might not be diagnosed as early, or they might experience a lot of undetected chronic pain from things like dental issues and arthritis and so on. So being proactive about this is so very important for your cat's quality of life and for their welfare. Now, this stress reduction actually starts at home long before vet clinic appointments. You need to pick an appropriately sized carrier that has an easily removable top, and you need to put very comfy bedding into it and leave it accessible for your cat 24/7. It's ideal if you can intermittently hide some treats in there for your cat to find, because we want your cat to think about this carrier as a comfy place to rest and that they have good experiences and memories tied to that carrier. Working with a skilled, strictly positive reinforcement trainer will be very helpful in developing a plan to help get your cat used to spending time in that carrier. And once they easily go in and out of the carrier and are happy to spend time in it, then you will need to start working on moving the carrier with the cat in it. Now, one common mistake that I see people making is that they're carrying their cat in the carrier with one hand on the handle. This is a no-go. Never ever do this, because the carrier will be tilted or swinging or both. You need to carry it with both hands and support under the bottom so that your cat remains stable and that they're not tipped on an angle and they're not swinging around. Once you have practiced all of this, then you need to start getting your cat used to being in their carrier in a vehicle, and eventually in a vehicle that's moving. You also need to work on teaching your cat to take medication by mouth on cue. Now, I do have a previous video covering how to go about doing this. I'll make sure it's linked in the video description for you. I was prompted to do this video on this topic because of a research study that I recently read. It came out about a year ago, and it was comparing the use of gabapentin versus some other environmental management versus placebo, and how stressed cats felt during veterinary clinic visits with those interventions. Now, each cat went through each category, and their vet clinic visits were separated by a week of time. Their cortisol levels were measured in their blood as a way of assessing how much stress the cats felt. Now, when the cats went through their placebo exam and blood draw, their cortisol levels were highest. When the cats had received one dose of gabapentin 90 minutes before starting travel to the vet clinic, this reduced cortisol levels into a normal range for about 75% of the cats. When the cats received therapy and music therapy as well as chromotherapy, it reduced cortisol levels for about 80% of the cats. What we need to learn from this is how important it is that we do these things for our cats. For gabapentin, it is often recommended to give one dose the night before and then a second dose 90 minutes or so before starting your trip into the vet clinic. It's also important to realize that there is quite a dose range for gabapentin, so doing some trial doses and a little bit of trial and error to figure out what dose works best for your cat will also be necessary. Next, we should be using Feliway spray. This is a pheromone spray that lasts for a couple of hours, and you can spray their carrier with the Feliway. Now, it's important to remember that the aerosol does need about 10 minutes to dissipate after you've sprayed it, so make sure you're giving some time before the cat is expected to be in the carrier. Calming classical music is also a research-based intervention to help reduce stress for our cats, and keeping the lights low in the exam room is also helpful. So you should be playing calming classical music in your vehicle, and hopefully it will also be played in the vet clinic that you go to. This is proven to reduce stress for many cats, and it will help to cover up any unknown or potentially scary noises that your cat might be hearing traveling to or at the vet clinic. And then lastly, we need to consider the chromotherapy, or the light that we are exposing the cats to. Using a towel to cover the carrier can help your cat to feel like they're able to hide a bit better and reduce any bright or scary lights that they might be exposed to. I prefer working in vet clinics that have dimming slider lights so that I can dim exam rooms to be light enough that I can still safely see what I'm doing, but not have that very bright clinical overhead lighting that some other clinics will have. Now, some cats may require additional medication to the gabapentin, and that might mean giving medications for motion sickness. We use Cerenia appropriately dosed in these cases. Other cats might need additional medication by mouth to reduce situational stress. We might use something like trazodone or alprazolam for this, and I have some patients that even if we do everything perfectly, they are still fairly stressed in the vet clinic, and sometimes we just need to give them some injectable sedation so that they don't have to feel stressed or remember anything that is occurring while they're in the clinic. Now, it's up to you as the guardian for your cat to always advocate for your cat. If something is going on and you know that your cat is getting too stressed by this, you always have the ability to say, we need to stop this and make a different plan and come back a different day, unless it's an emergency. If we're in an emergency situation, unfortunately, sometimes there are going to be patients that are just stressed, but it is literally a life or death emergency situation, and we have to always keep that in mind. But if it's just maintenance, preventative sort of veterinary care, then we usually have the option of stopping and formulating a different plan to reapproach whatever the cat needs on a different day. It's often possible for me as a veterinarian to do the majority of the things that your cat might need while they are inside their carrier. And this is part of why having a carrier with an easily removable top is so important. We can remove the top, put a towel over the cat, and then I can just kind of expose the parts that I need while the cat still feels like they're hiding and safe under the towel. Some cats don't like towels, and then that's fine, we don't use one. And sometimes we do have to remove a cat from their carrier, but it's much less stressful to do that if we can remove the carrier's top, put a towel over the cat, and then lift the towel and the cat out of the carrier. And this is one of the reasons why I'm constantly hounding people to bring video of how their cat walks and jumps and moves and plays at home with them to their appointments for their cat for me to see. Cats often don't want to do a lot of moving around in the vet clinic, and when I don't see those videos, I'm going to be more likely to miss chronic pain, and a stressed cat is going to be less likely to exhibit symptoms of pain during a physical exam. And so having those videos is truly invaluable and will mean that I can better treat your cat and manage any issues they might be dealing with. Once everything is done in the vet clinic and you and your cat are headed back home, your job isn't quite over yet. It's important to remember that cats will often need a careful reintroduction after they have left the home. Other cats in particular might be quite upset by this cat smelling differently than they used to, so having a reintroduction process is key and will reduce stress between the animals within your home if there are others. And there are... Okay, thank you. Oh, good dog. Oh, good girl. And there are some cats who might need a couple more doses of gabapentin after they get back home because they might still have some stress from the whole experience, and reducing that stress over the next day or two can be very helpful to them. Now, if you have any questions or if you have a topic you'd like me to cover in the future, please tell me about it in the comments section. I always love to hear from you. And we do put out a new video most Fridays. I look forward to seeing you in the next one, and I hope that you and your cats have a wonderful week. All right, bye-bye.